All of us are watching the news and looking at situations like what's happening in New York, in New Orleans, in Detroit, and seeing incredible surges of this pandemic because the COVID-19 virus has such a high transmission rate. And so as a community, we need to be thinking about and planning for the potential of a surge. And even though right now we are not seeing that, we have been planning for weeks to be able to handle that should it manifest in Lawrence and in Douglas County like it has in other places. So for example, our hospital is licensed for 174 beds. We often have around 100 to 120 patients. We are prepared to go up to 255 patients through 3 phases of implementation. We have developed plans in-house for how we move in phase 1 to up to 200 patients and in phase 2 to up to 255 patients. That's really good news. We have the staffing and the inventory, the PPE, and the specialized equipment like ventilators to accommodate what we believe could be the potential of a surge in Kansas. LMH Health is this community's hospital, and we want you to be confident that we're prepared for a surge, that we have adequate equipment and supply for a surge, that we have the staff. You know, a surge means an enormous jump in the number of patients, and we will have the staff and facilities, beds, and most importantly, the clinical staff to do that. Our medical staff, which in many areas have seen a significant decline in their clinics, let's say, have signed up and are ready to come into action to be prepared for a surge. We've had almost 70 clinician providers volunteer to come and work in the hospital to support the emergency room, to support our inpatient units, to support the ICU. And those clinicians are even now taking additional education, refreshing their experience in ICU and ventilator management, and in just where they can support a surge in our community. That's an amazing and encouraging thing to be a part of. We find ourselves at this moment being in a very strong position as a community and as a community hospital. We have had for a number of weeks our respiratory evaluation clinic where we're seeing around 30 to 35 patients per day. That's been very consistent. We've actually seen a decline in our emergency room volume, and we have had inpatients, but very few. And so we find ourselves at this moment where we see around the country other places that are really struggling, and we're doing well. That's really great news for our community, and it's a reflection of the social isolation parameters and guidelines that you have been following. It might be tempting to declare victory and to say, okay, we're really through this, we're going to be fine. I urge you not to jump to that conclusion. It's very possible that we will have multiple surges, and that while we have done a great job in controlling our transmission through social isolation, we need to keep that up for a while longer. It will still be possible for transmission to get out of hand if we respond too early. So let's hang in there, follow CDC guidelines, follow the KDH&E guidelines, react to the data about what's happening in our community, and stay together in our response. That will keep us all the safest we can be, and ultimately we'll look back and be proud of the way Lawrence and Douglas County have handled this pandemic.